According to a new report, Canada is the most permissive country in the world regarding legal and medical gender transition processes for minors. The study was published by the Calgary-based Aristotle Foundation for Public Policy and Do No Harm, a group of healthcare professionals and policymakers who advocate for keeping identity politics out of medical education, research, and clinical practice. The minimum age for puberty blockers is vastly more liberal in Canada than in any other country, the study found, noting that 8 of 10 provinces have no minimum age requirement. Alberta and Nova Scotia are the only provinces with some age conditions in place. Alberta bans puberty blockers before age 16, while Nova Scotia requires applicants to reach the second stage of puberty, which typically occurs between the ages of 11 and 12. 7 of 10 Canadian provinces have no minimum age requirement for cross-sex hormones, with Alberta, Saskatchewan, and Nova Scotia being exceptions. In Alberta and Saskatchewan, hormonal treatment is banned for children 15 years and younger. As with puberty blockers, children in Nova Scotia cannot begin treatment until they reach the second stage of puberty. Most provinces in Canada set 18 as the age of informed consent for sex reassignment surgery, although 4 provinces allow it at earlier ages if the minor is, quote, deemed capable of making informed decisions without parental consent. Saskatchewan, Manitoba, New Brunswick, and Newfoundland and Labrador follow that philosophy, while Alberta, Ontario, and Prince Edward Island all adhere to the 18 or older rule. In British Columbia, surgery applicants must be 19 or older for bottom reassignment surgery, but permit top surgery with consent of the applicant or their guardians, depending on their assessed capability. In Quebec and Nova Scotia, patients must be at least 18 for bottom reassignment surgery, but can request a mastectomy at the age of 16.